Great. Thanks, Bridget. So welcome to today's webinar, Narrowing the Healthcare Digital Divide with Intentional Technology and Innovation. I'm Patty Inrado, Senior Director of Client Content Development at HIMSS. And I'm joined with Dr. Azizi Seychus, Assistant Professor of Population Health and Psychiatry at NYU Langone Health, and Daniel Colling, Global Head, Healthcare Industry Solutions and Practice at HP. Welcome, Dr. Seychus and Daniel. So I'm hoping both of you can talk a little about your background and your passion for addressing the healthcare digital divide. So I'd like to start with you, Dr. Seychus.
Well, thank you so much, Patty, and thanks to HIMSS as well as HP, as well as to the many attendees today. I think, my humble beginnings coming from an inner city community in Kingston, Jamaica, and seeing the stark differences between the haves, the have-nots, and the have-mores has struck an accord with me. It has impressed upon me that I should lead a life that is full of service, one where I am in this constant, perpetual process of kenosis. It's a Greek word that means self-emptying. And the reason why that's important is because we need to, in order for us to make significant changes to our healthcare system, one, in which we provide the best value-based care where it's accessible and effective and cost-effective, that we need the best solutions. And so this sense of transcending myself beyond who I am is what drives me, and I'm very passionate about, and I truly believe that technology can serve as that one equalizer to improve value-based care as well as improving access to care. And so that is the reason behind my why and the reason why I am committed to doing this work.
Great, thank you. Daniel?
Thank you so much, Dr. Seychus, and it's just wonderful to have you on this webinar. A huge thank you to everyone who is participating today, and your time is extremely valuable, and we so appreciate your collaboration. And to continue this message after this webinar within your healthcare organizations and within your communities. Today, what we are going to touch base on is certainly what has been the conversation, right, Dr. Seychus, for well over a decade, but it really became prevalent with what occurred with the COVID-19 pandemic. And as such, for myself, starting off as a nurse 20 years ago, and having the that real connection with our patients that unfortunately many of our patients don't have the technology, they don't have the skills, they don't have the socioeconomic support to get the care or even to communicate what they're trying to get to their healthcare providers and to their healthcare systems. And so with that, really excited for this webinar to address these challenges with Dr. Seychus and how we can then take this message on and really try to make a difference. And now there's no greater time than now, I believe, to turn the table and look at each other as peers and look at each other as families instead of areas that we, like you said, Dr. Seychus, the haves and the has-nots. We're all in this together. Healthcare is universal.
I agree, and I'm looking forward to today's conversation. And being in your company, Daniel, I am just so honored. So looking forward to a great discussion today.
Great. Thank you so much. So I want to take a step back and look at this digital divide in healthcare. So our healthcare industry has been immersed in transforming how we deliver care through digitization of information. Digital transformation is expected to improve patients' care, their outcome and experience across the care continuum in the most efficient and effective way. And to do that, innovative technologies are enabling patient information to be gathered and to be accessible to both providers and patients. But we have a problem. So the digital divide is even more pronounced in healthcare, with underserved communities being unable to access their medical information, and that severely impacts their ability to engage in their care plans. But we don't have to accept the status quo of the digital divide in healthcare. So in today's webinar, Daniel and Dr. Seixas will discuss how technology and innovation, when implemented intentionally and with these communities in mind, can really bring all providers and patients together and positively impact patient care. So let's turn to the issue at hand. The digital divide in healthcare comes into stark relief when you consider these realities. So according to the Pew Research Center, nearly 1 in 8 Americans live in poverty, with low-income individuals having lower rates of smartphone ownership, home broadband access, internet use, and basic digital literacy. And furthermore, at least 1 in 4 Americans likely don't have digital literacy skills or access to internet-enabled digital devices to engage in telehealth visits. The Pew reports that 40% of American adults age 65 and older own a smartphone or have broadband internet access. And it also found that while 96% of Americans own a cell phone of some kind, among Americans with annual incomes under $30,000, only 56% have home broadband access.
Thank you, Patty. So what we'd like to do is just draw some real patients here that really went through this pandemic and how the digital divide truly impacted them. So the first patient that we're going to talk about really briefly is, this is Frank. He's 74 years old, and he's undergoing cancer treatment. His doctor, Dr. Temple, is an orthopedic surgeon, but also an oncology a subspecialty in oncology. And because Frank and his wife, they live in a rural setting, they do not have the capability or have the funds to afford, high-speed internet. And so, Dr. Temple really, when it came to providing video conferencing, for example, after biopsies or reconstructive surgery, she tried to do that as much as possible. But with rural patients like Frank, they don't have the technology, and they didn't have home internet for that virtual check-in. The other thing that was really tough is an issue such as, hospice care and end-of-life care decisions being made over the phone. It's extremely difficult for this to occur for Frank and his wife. Not only is it difficult for Frank and his wife, but also for Dr. Temple to discuss these real critical life decisions over the phone. So this is just one example of the digital divide. The other is on the back, and the kind of the behind the scenes, what occurs in this instance as an example is the images that Dr. Temple needs. It's very difficult living in that rural environment for MRIs or CT scans to be sent or received because of the lack of bandwidth. The other patient that we want to talk about is when it comes to, 13-year-old Aster's mom. So Dr. Abbas, he's a nephrologist, and Aster's mom sees Dr. Abbas typically face-to-face. And the reason why is her mom doesn't speak English. And her mom really, looks forward to meeting Dr. Abbas. Of course, there's an interpreter that really helps with overcoming that language barrier. And there's just joy and when it comes to that eye contact and hand-holding as an example for providing that empathy. So because of that disconnect of not having the right tools and technology, one of the really tough things that was occurring is, in this example, by the time the translator came on with the physician, Dr. Abbas, and in this instance, they weren't able to download the app, it was over. The consult visit was over, and it had to be rescheduled. So this is an example of what has occurred. And the challenge here is if the conditions for Aster's mom escalate, then that's going to be difficult for intervention to occur. The other patient is Barbara, who's 83 years old. And Barbara, like many of your potentially mothers or grandmothers, they are not, they did not, they did not grow up in digital age. And with that, this example is Barbara's physician was trying to have a video conference, and she just didn't pick up the video call because she thought that her phone was broken because she couldn't remember the password. So even though, Barbara spent a lot of time preparing for that call with her physician, it didn't occur. And then there was multiple follow-ups, which we call phone tag, of course, back and forth to try to be able to get her physician back on that line. The last patient, which we saw a significant impact to, and often we forget, right? But there are 61 million people in the United States that have a disability. And this digital divide for people with disabilities really came to the forefront during this pandemic. And so although people with disabilities, we know there are health disparities, among this patient population, often they're overlooked in the types of technology that they will be utilizing. Often technology or software applications or web apps are designed for everyone. And with that, it's very difficult for a patient that not only is disabled, but may have chronic diseases that need to be able to be addressed. The other component is not seeing that John here, as that has this disability. The challenge is the physician cannot potentially make that eye contact, or they may not be able to see, hey, John hasn't been able to clip his toenails this past week or past couple of weeks, or maybe what about his cognitive decline? So these are just 4 examples of patients that these are real examples. We've changed the patients' names, of course, and the physicians, but this is what has come about, and really why this is the top of mind and forefront when it comes to how we can address the digital divide.
Great. Thanks, Daniel, for putting the backstories to these patients. So I want to ask a question for Dr. Seixas. How can digital health and information technology, improve or enhance the care team experience and services to these vulnerable populations?
Sure. So, Patty, thank you so much. But if you just give me a little bit of time, let me just comment on the beautiful and so emblematic stories that Daniel just highlighted, because I know people in the audience might be thinking, I think people might be asking, what then is a digital divide? And I think, there are 3 primary components of a digital divide. Because, people, oftentimes we may not have a good understanding as to what digital divide is. So the first component of a digital divide is that there's an economic component where individuals are unable to purchase or afford a device or the software or the broadband that comes with that. So I just want people to be aware of that first component. The second component of digital divide is use, whereas Daniel pointed out that there is significant, and you as well, Patty, pointed out the underutilization of certain technology, components and products. And in some ways, it can be as a result of, low technical or technology skills, or it may mean that there is lower self-efficacy, meaning do patients believe that they can master the use of such products? And the third is empowerment. And empowerment is a little bit different from use. It means, therefore, can you instill in our patients that when we give them a tool that they feel empowered enough to use it and embed it in their everyday lives? It's something what I call traversive use, whereby if you have a particular solution like an iPad, do patients use it just for one thing based on what we ask them to do? Or can they use that same tool for other things where they can search the internet for relevant information. So I just wanted to come back to that because I know people in the audience might be wondering, we talk about digital divide, but we're not sure, are we quantifying it in terms of just numbers, or is this a theoretical one? And I just wanted to underscore those three components. So back to the slide. In terms of what people can do, how can the care team experience be enhanced? And there are six primary components that I believe, not exhaustive, but I think these are relatively comprehensive. So the first is that it will allow for integrative experience with better infrastructure and stitching of silos. The reason why that is important is because what we do know is that there are a plethora of solutions, whether it be IoT devices, whether it be websites, whether it be other software, that our patients are inundated with. But what we haven't done, and we need to do a better job, is to piece them all together in this integrated experience where there aren't redundancies, but also in areas where it's seemingly disconnected, meaning, for example, you have a nutritionist telling someone you got to eat something or you need to eat healthily, but it is not connected with their local grocer's app, like an Instacart. So this is what data will allow us to do, where we can stitch these seemingly disparate components, but because the patient lives it as this unified experience, then we'll be able to stitch it all together. So that's the first. The second is it allows us to expand our services, focusing on what I call the 6 A's, based on a framework that I have coined called Precision and Personalized Population Health. And the 6 A's, the D stands for discovery, whereby we are now able to use technologies, emerging technologies, existing technologies, and new solutions to allow us to do a better job to identify unique mechanisms, causes, and etiologies of disease. So the work that we're doing at NYU now is that we are able to create a comprehensive health kit where we send to people's homes around 8 different devices that collects biometrics sensing data as well as biospecimen data. And so this is one area that we can do. The first A is primarily focusing on awareness. Why? Because through data, through technology, we are now able to find unique ways of making people aware of their risks for certain diseases and or better aware of evidence-based strategies to manage their disease and wellness. Avoidance. This speaks to prevention. Why is that important? Because once you're aware as to what the risk factors are and how to better manage, perhaps you could stave off the unfortunate trajectory of disease. And then it helps us with access, the improvement of access, where we know that there aren't enough healthcare providers to meet all the needs that our population has. And so through technology, through data, we will be able to improve access. And thus it will allow us to improve assessment of risk, as well as the management of risk. And it will also improve acceptance to solutions and interventions, as well as long-term adherence. Third, it would improve the quality of care. Why? Because we have to take into consideration that in order for us to meet our patients and to provide value-based care, care that is accessible, that is affordable, that is one that is patient-centered and person-centered, we need to have some embedded form of technology. And fourth, it will allow us to better engage with and activate our patients. Why? Because we know that pre-pandemic, that it was hard for us to connect with our patients, right? So if you have a patient and they only see you every 3 months or every 6 months, you are missing, the time in between visits, and we aren't able to engage our patients. So through this enhanced experience of more data and greater technology and greater connectivity, we are better able to engage and to activate patients, particularly as it relates to health and wellness. And fifth, it improves access to care, because once we can create solutions, technological solutions that can be easily scaled, then we now can be able to send it all to all the different corners and crevices of our society. So we don't have the excuse anymore that the cost is too much, because it has been shown that digital solutions, though might be expensive in the beginning in the R&D phase, but once scaled, it actually cuts costs. And last but not least, it allows us to focus on the whole person. So we know that medicine is so fixated on specialization, but what this will allow us to do is that the nephrologist could speak with the case manager and nephrologist could speak to the primary care doc, could speak to the nurse, could speak to a nutritionist, and could speak to all the different folks in the care team model. Why is that important? Because this is how we need to treat our patients. And that whole person approach has proven in the United States and in other contexts to be an effective strategy in creating long-term management of chronic diseases and other forms of health and wellness.
Great. Thank you, Dr. Seixas. So this is a question for Daniel. What are some strategies that enable access to patient data anywhere?
Thank you, Patty. And Dr. Seixas, I love how you were able to focus at the end, which is focusing on the whole person. Because focusing on the whole person goes beyond the clinical interactions and really goes to, like you said, the nutritionist, the nurse, and then even into the community. So the environmental impacts that are associated to that patient and their wellness really will help with a proactive approach of, hey, me, patient, as an example we had earlier, Barbara, would be able to proactively participate in her own journey for health and wellness. So what I wanted to just first set the foundation for is the health record in the United States. It is your health record, and although it may be in many different hospitals, it might be a health record with your primary care physician, you might have a health record with your nephrologist, as Dr. Seixas just talked about earlier, or your nutritionist. Regardless of who is looking at that patient record, that's your record. And something that has certainly come forward is ensuring that you have the correct information within your record, kind of like your credit score really provides the entire care team the capability to provide you the best care possible with a proactive approach. There's lots of mechanisms to get your health record, and I think in the past it's been very difficult, but there's been certain strides and motivations, not just for healthcare systems, but the entire U.S., everyone that is engaging with a healthcare organization, you having that access. Because if you have access to your health record, you are empowered to be able to participate in your wellness journey. The other is just to keep in mind, there's the law states that you are able to access that entire record. And so if you have questions, I know a lot of us don't like to go to government websites, but healthit.gov, there's some really nice, easy to see videos that I've shared with lots of healthcare organizations that and patients. And then, of course, there's hhs.gov, but I think there's some really great innovative videos and very easy interactive videos that they've put online for people to get access to their patient record. The other is really when it comes to this word that we often say is interoperable. And all that means is what Dr. Seixas was talking about earlier, is giving the right information to the entire care team, including the patient, right, at the right time to be able to provide clinical decision support making. And so one of the challenges, though, that we still have today is a lot of the electronic health records, you know, there are disparate systems and they don't communicate with each other. And so patients, you know, when it comes to digitizing a record or digitizing imaging or digitizing information that's required, you know, we've really been able to be creative here and look beyond our typical methodologies. The solutions can be really straightforward. So instead of sending a one-way text message, we could use an interactive two-way SMS system that would enable the capacity to triage patients' needs. Another example could be when we were speaking about earlier with Astor's mom, you know, that doesn't speak English. What about providing just very digestible infographics, right? So little emojis that can be sent to that patient to convey the message and then have her be able to participate in her wellness and then communicate back. The other would be, instead of communicating about health plan benefits, like in English to non-speaking patients, sorry, non-English speaking patients, you know, and then incurring those costs for translation, we could provide other really creative mechanisms or creative platforms so that the patient can use pictures or drawings or other ways to express how they can access this information or participate. So with that in mind, Patty, if you could expand that to Dr. Seixas, I think he has some really great items to cover.
Definitely want to ask the same question, you know, for Dr. Seixas. You know, what are some strategies that enable access to patient data anywhere?
Well, I mean, these are some huge questions, and to be quite honest, this particular one is very central, because if we were to peel the layers of digital divide, I think what you heard Danielle and I just described previously was that, you know, a quantitative approach, right? This was where I had laid out the economic argument. You remember those three pillars, right? Economic, use, and empowerment. So I think this question certainly speaks to use and also empowerment. And in order for us to fully appreciate strategies, we must have a fundamental understanding. This is like the fundamental you know, maxim, which is patients own their data. Let me just say that again. Patients own their data. And the reason why that is critical is because that must be communicated to patients. Because once you empower patients to say, hey, I am putting on this, tracker or wearable, or I'm sending you home with this device, it becomes this partnership between yourself and the patient. And you said, Miss Jones, we're trying to figure out why is it that you're on your statin medication, but your clinical outcomes still are not coming down, and I want to get to the bottom of this. And so together you form an alliance. But then you tell Miss Jones, I am not at home, and it's tough for you to provide detailed self-reports. How about I provide you with this solution, this device? This is what it uses. It's not supposed to infringe on anything, and you lay out how their data will be protected, right? Because that is key, because security, privacy, and confidentiality is key. One of which is to reassure them that it's their data, not ours. but also to provide some insight as to the different technical, but we have to bring it down to our 5th grade level, the different privacy and technical infrastructures that we have in place to safeguard, right, any particular breach. So that's the first thing. Once we've established that patients own their data, then that establishes trust. Then we can utilize these following strategies. First is to create user-friendly interfaces. Why? Because I cannot tell you, folks, how many times we have naively sent things home to people, like an iPad or some device, and it looks cool, but they put it down on some shelf and it gathers dust. So the way in which we can use these solutions as a way of engaging them is to make it user-friendly. So we use some solutions that measure cognitive assessment through augmented reality testing. And we're like, no, it's a 10-minute assessment, and trust me, it is going to be easy. But when we send it home to them, then clicking through the app or the software is just too cumbersome. So you want to ensure that the solutions that you have are user-friendly, and there are ways of which you can do that. Make it bite-sized. Walk people through each step, ensuring that it is clear and that they understand what to do. And before we send home any devices to people, before they leave, we ask them to walk it through. Now, because we're doing things remotely, we have a Zoom or some video conference with them, walking them through, ensuring that they know how to use it. And if you're developing a solution, you should have some form of teaching element and ensure that there's teach back. So once we've established that these interfaces are user-friendly, a lot of folks want to know, will they be able to get some instantaneous feedback about their own health data? And so it's important to ensure that these data are in real time, and if not, explain it to them. But explain it to them from the vantage point and be honest, yes, there might be a technical issue in terms of there might be a lag. But you also want to say, well, I think it's important for you, Ms. Jones, that we don't look at your blood pressure every 15 minutes. Instead, we would rather provide you your blood pressure readings over a 3-day period. So this is where you have to communicate with patients, even though they may want the data in real time, but you have to make the case as to why you are providing it to them in this intermittent way. The next one is that we have to ensure that we create these mHealth and smartphone portals. What does that mean? It means, therefore, that we need a variety of solutions, specifically applications, and also maybe web applications. And why is that so? Well, an app versus a web application versus a website, they operate differently. And, and people with different digital personas might be more comfortable with one over the other. And so what we know is that with a website, that you could make changes continuously to that website. But an app, which is on the other side of things, it is hard for you to make large sweeping changes to it. And so if you're trying to establish rapport with these individuals, and you're trying to ensure that everything is consistent, whereby you probably don't want to change it continuously. Interoperable platforms, and Daniel spoke about this beautifully, so I don't think I need to speak too much about it, but just to underscore the fact that having interoperable platforms, and essentially what this means is that we can have different solutions talking to each other, but at the same time, we're not wedded to a platform. So for example, iOS versus Android, right? You want to create solutions in which that someone with the lowest technical skill or their apparatus might not be the most recent. We want to ensure that their particular tool can use any of those solutions. And the last two, really speaks to the heart of ensuring that we make clinical data, more so connecting them with what we call consumer-friendly platforms. And this idea is about finding ways in which we can collect data from multiple sources where it can be harmonized and synchronized in one way and in one particular platform. So, for example, the Apple Health Kit is one great solution. I know HP has something quite similar with their HP remote patient monitoring solution. And the reason why that is important is because what we're going to see post-pandemic, or as we move into this new abnormal, is that we're going to be sending home many of these IoT solutions. But the problem is that these IoT solutions were never created for this large scale. They were primarily developed for personal use. But as they become more and more part of the machinery of our healthcare systems, we must ensure that the solutions that build as the blueprint and the pillars of it are robust. And the Apple Health Kit and the HP remote patient solution is such. And last but not least, we want to ensure that if you're creating a solution, that we must ensure that it has some API, an application programming interface. Why? Because, as I had mentioned previously, if we are in the business of taking care of the whole person, we cannot silo the different components. And so one app may actually inform another app. But the way in which you can bring it all together under one house, under one solution, is through API integration so that they can have the necessary handshakes with each other. And all of those strategies together will ensure that we provide the best access to patient data anywhere. So I know Daniel is going to kind of add to this, particularly in terms of what HP might be offering, because I obviously can't speak to that. So Daniel, I'll turn that over to you to comment on that some more.
Great. I think we do have a question, Dr. Seixas, later about that. We do have another question that I want to ask the both of you is, and I'll ask Daniel first, is how can we empower patients to take control of their wellness and treatment plans?
With empowering patients to take control of their wellness and treatment plans, one thing the pandemic has brought to the forefront with the escalation of health disparities, it's really forced our national conversation around health equity. And what do we mean by health equity? So to really make progress on health equity, policymakers, health systems like the Dr. Seixas participates with and works at, innovators like HP, a technology company, there's funder groups that are all working together. We all have to work together. HP has to work with healthcare systems and vice versa. And we have that ability to recognize this opportunity to reassess and strengthen these connections with our underserved communities. So with that, using the patient's language and their style, I love how you said that, Dr. Seixas, is using their style of learning and having them walk through that user-friendly, because you first have to develop it. So the technology company has to work with the health system or healthcare providers so that it is user-friendly. But then providing the ability that the patient, in this instance, the 83-year-old patient, Barbara, who didn't pick up the doctor's video because she thought her phone was broken because she couldn't remember her password, for her to go home, giving her the skills and the technology skills and technology literacy, if we want to call it that word, will really help with her participating in that journey. And the tools and guidance, they have to be her walking through how she's going to do this at 83 years old instead of just instructional. And she's going to learn differently than maybe the way Dr. Seixas and I learn. So we need to customize, not necessarily customize, but have a framework that is personalized, is the better word, specifically to Barbara. The second area to expand on this, Dr. Seixas was talking about was, good information will provide good health, and looking at that whole person. And one element that has risen forward is misinformation. And history has certainly shown us that tragic consequences, that spread information during a health crisis really can face just items that we as a whole country and citizens of these communities are impacted by. So in short, one of the most important elements that we're going to talk about in a second with Dr. Seixas is low health literacy. And low health literacy isn't just people that are in lower socioeconomic patient populations. They can affect people of all ages and incomes, but clearly there are some that are more vulnerable than others. And so with that, our field, healthcare professionals, I think we're in a really good position now to provide, all of our communities health literacy with concrete strategies that can be broadened from healthcare organizations, partnerships that we have with our community, cross-sector collaborations, and even individual healthcare providers, so that our patients have the right information to make those right choices so that they can participate in their health.
Great. Thanks, Daniel. So want to ask you, Dr. Seixas, that same question of how can we empower patients to take control of their wellness and treatment plans?
Wow. I mean, how do you follow up, Daniel? But I'll try, Patty. I think there are, based on my work over the years, I think I've identified 6 ways in which we can empower patients. And this is the work that we do at NYU, and it really is part of the DNA of the Media and Innovation Lab that I've created at NYU. And the first strategy that we utilize is that we try and demystify and democratize treatment plans as well as data, especially since we're looking at treatment plans from a digital lens and a technological lens. And you may ask, what does that mean in terms of demystifying and democratizing? First of all, there's a lot of data out there, and there's a lot of technology, and there are a lot of solutions. So one of the things that we do in our studies, one study that we currently have, where we are trying to improve the adherence to sleep, physical activity, diet, and stress management of patients with type 2 diabetes and or hypertension. And we give them, several IoT devices, a wearable, and we have, a phenomenal, photo food diary app that we worked with our colleagues in the formation. And we had to spend, on average, about half an hour just setting people up and to tell them, this is what data means, but this is how data can liberate you. This is what it could add. And I tell you now, we have people on our study, and they don't want to return the equipment because they said it has been so transformative, not because of our study was great, but because of how we democratized the experience for them, and they got so engaged. The one other area that we try and focus on is we pay special attention to potential barriers to engagement and empowerment. Because when we, say, well, we need people to take control of their wellness and treatment plan, we have to deconstruct that a little. Because we're not positing that people don't care about their plan. People lead very busy lives, as well as sometimes treatment care plans are so fragmented that it's hard for us as clinicians to manage. Can you imagine our own patients? So what we have to do is that we have to be able to identify what are some system level barriers or some social determinants of health. So when you have a patient not showing up to, their clinic visit, it's not because they don't care. It's because they may have transportation issues, or they might have child care issues where an aunt who should have, come to their home to take care of their 2-year-old and their 5-year-old is sick and who is unable to take care, so they're unable. So if we have a digital solution, then we remove all of those transportation and social determinants of health barriers. Social care navigation is key, where we've created a social care navigator to help people to circumnavigate these social determinants of health. We also try and improve health literacy. Improving health literacy focuses on, knowledge, numeracy, navigation, and communication. And that's, how we try to improve health literacy. Then we try and reduce cost, because that's key. Because if people know that this is an economic solution, then obviously they're going to invest more in it because they can see the return on investment. And lastly, we have to make healthcare services easier and more user-friendly. We have to make it simple. Going to get a checkup, we got to make it a simple experience where people are looking forward to it. But even if they don't have to go to a physical space, if it's telehealth, then they could say, hey, Dr. Seixas, this is what we were able to find. I see that my steps count is associated with the reduction in my blood pressure, and then you can reinforce that. So then what happens is, instead of it changes the entire structure and conversation with your patient, where it's less about checking in to see what's going on in between visits, but more so providing more deep insights, because our patients are smart and they are intelligent enough to take control of their care. So I think those are the only things that I would add, Patty.
Great. Thank you so much, Dr. Seixas. So, Daniel, I have this question for you. So in light of what we've discussed so far, what can healthcare IT technology partners do to support healthcare providers and their patients in underserved communities?
In respect to what you said earlier around the removal of barriers, what we've really striven to do from the beginning of our founders, but what we continue to do is try to remove these barriers at a global scale. So focusing on the patient, on the person, then the community, and if we can start with the person, then that impacts the community. Then impacting the community can impact that country. And then hopefully we can play a role in being part of the solution of helping sustainable development goals that the UN has set out for the next decade for an improved healthcare and quality of life. And what Dr. Seixas was talking about earlier, health literacy is just a critical element to be able to have patients participate in their wellness journey. We've committed, as an example, tomorrow is Earth Day. So folks, if you don't know that, April 22nd is Earth Day. And there's two things, I always say this, there's two things on this planet that impact all of us, our health and the world that we live in. And so the planet that we live in plays a really critical role with our health so that we can continue to live these wonderful lives and improve our health. So what we've done is we have announced 11 of the 17 UN Sustainable Development Goals that HP is participating in. On February 11th of this past year, we announced our first of its kind a sustainable impact program that we have we've put this forward to all of HP's partners. So really trying to expand this participation beyond just HP. And our goal is to work with our partners to really drive this circular and lower carbon economy, as an example, really an inclusive and equitable supply chain, and improve these communities where HP has factories, right, where we have buildings where we have people that are participating and our children participating in schools in our communities. The third just highlight I wanted to just bring up as we're wrapping up here is HP. We were able to partner with, it's called the Wonder Project, and it's Dr. Kupaswamy. And it's just been a phenomenal honor to be able to work with Dr. Kupaswamy and her team specifically around a proactive approach to maternal health. And in the U.S., we are very blessed. We don't have the same challenges, but they still exist in rural areas. But the reality is there's 830 women that die every day from a preventable cause related to pregnancy and childbirth. And this is a global challenge. And so what we've done is we've been able to really have the honor to partner with Dr. Kupaswamy. It's called the Wonder Project, Women's Obstetrical Neonatal Death Evaluation and Reduction Program. And it has some of the elements you talked about earlier, Dr. Seixas, with biometric technology, having that real-time data be sent to the care provider so that they can react appropriately. Lastly, two other elements is with education and schooling being put on hold, we really wanted to ensure that students that don't have the funds, they don't have the capability to be able to utilize technology and compute devices. We did multiple programs, and these are really fun, engaging, educational, whether it's through printed paper, right, or printed programs that could be delivered to the patients that don't have Wi-Fi capabilities, in addition to donations of compute devices. And really, we wanted to make sure that we're partnering with organizations to make sure that all children are not as impacted as much when we're talking about this digital divide, because that also was at the forefront. And then lastly, cloud-based digital platform. So we have a solution that we have partnered with. It's called the HP WorkPath platform, and it is an interoperable platform that allows a lot of the elements Dr. Seixas talked about earlier, apps that are user-friendly, that can be accessed on multiple types of modalities and platforms, iOS, Android, and they provide the ability so that information can be sent and received and interacted with appropriately. So thank you so much for allowing Dr. Seixas and I to be able to participate today in your hour of your day to talk about the challenges of the digital divide. And I hope and we hope that this message can continue to be echoed throughout your communities and to play an active role within our communities, because we all live in our communities regardless of the employment that we have. And this problem is our problem. It's not a I problem or a you problem. It is our challenge that we need to address for us to all be healthier and participate in our wellness journey.
Great. And thank you so much for your time, Dr. Seixas and Daniel, for sharing your insights into this challenging issue in our industry. Discussion will be ongoing, but we hope, we'll move forward with progress. So thank you both again. And I'd like to thank all of you out there for joining us, and thank you to our sponsor, HP.
All right, and before we jump today, I just have a couple reminders for the audience before we go. A survey will pop up on your screen at the end of today's event, so if you would just take that and share your thoughts with us, we would really appreciate it. And finally, today's session will be available on demand through the HIMSS Learning Center, so you can come back and watch it at any time. All right, thanks everybody. Have a great day.